Good evening, friends, and I'm sure most of you would have seen this ICMR data in the newspapers, and it doesn't surprise most of us in the medical community. And I had asked a question whether mental health is anyway connected with diabetes diagnosis, and most of you have replied yes. And the answer from me and from the field of psychiatry is yes, yes, and an emphatic yes, because the data shows that up to 30% of all diabetics may be having a depressive episode at any given time, and only half of them seek treatment from professionals. And diabetes and depression have a bidirectional connection. So whenever there's a worsening of depression, and whenever there's a worsening of mood, there's a worsening of diabetes, and whenever there's a worsening of sugar levels in the body, that could be a risk factor for deteriorating mood. So they have a bidirectional connection. And the other disorder which is very common in diabetics is anxiety disorder, the category of anxiety disorders, and among which generalized anxiety disorder is one of the most common. And it's estimated that about 20% of all diabetics have an anxiety disorder. And even before an diabetic develops uh, diabetes, if he has had an untreated anxiety disorder, that can predispose him towards developing diabetes. And there are many other disorders which are significant, like alcohol use, tobacco use, and psychotic disorders. Thank you so much.